In 2010, this woman Hamida, with 38-week pregnancy, came to the hospital with vomiting, abdominal pain, and severe headache. And her husband brought her to the Hobbiganj district hospital by rickshaw from a remote village. And she was diagnosed by the nurses in the hospital and treated promptly so that she couldn't develop the eclampsia, and she saved her life and her babies also. So these are the changes of our country. But still now we know that the eclampsia and pre-eclampsia is the second most leading cause of the maternal death in our country. 20% of the maternal deaths are from eclampsia. Pre-eclampsia means that the elevated blood pressure during pregnancy, and there is some other signs, danger signs also included. There's danger signs, blurring of vision, headache, and abdominal pain. When these danger signs leads to convulsions and fits, associated with convulsions, fit, it leads to the eclampsia. If you look at this decades from the 2001 to 2010, we have seen this 40% reduction in the maternal mortality, but still the eclampsia is the second to hemorrhage as a specific direct cause to maternal mortality. Every day, 4 mothers die in the Bangladesh due to the eclampsia. So, addressing the pre-eclampsia, eclampsia related mortality and morbidity is urgent need to reach the MDG 5. So, why do women die for pre-eclampsia and eclampsia? If we think that in our country that the antenatal care, the care during the pregnancy is very low, and when the women come to the care during pregnancy, and that care is also not up to the quality, because the poor detection of the blood pressure, poor measurement of the blood pressure, and poor detection of the protein in the urine is also one of the cause for this women develop the pre-eclampsia. And also we have some other causes that our pregnant women, when they are detected and referred to the higher facilities, they are reluctant to take the care for the management of the pre-eclampsia cases. And there is also limited access to the emergency obstetric newborn care in the facilities. Who are the risks for the pre-eclampsia and eclampsia? Actually, all pregnant women are potentially at risk. So, a family history with pre-eclampsia, eclampsia, a woman with the obesity, chronic hypertension or diabetes, or all in adolescence or the age over the 35 years, or fast pregnancy, these are the risk factors for developing the pre-eclampsia, eclampsia. Potentially we know that all pregnant women, they need the prevention and early detection of pre-eclampsia. What can be done if we want to address these issues of pre-eclampsia and eclampsia? This is, we can do the prevention, we can do the detection, we can do the management. So how could we do the prevention? Yeah, we know there's the supplementation of the oral calcium during from the second trimester of the pregnancy can prevent the some of the cases of the pre-eclampsia. And during ANC care, we can screening the high blood pressure and urine test so that we can detect the pre-eclampsia cases early, and giving them the loading dose, that is the first referral, first management, and then we can refer them to the higher facilities for better management. In this way, we can manage these eclampsia and pre-eclampsia cases in our country. This is the result, that if we do this proper detection and this management and prevention, then we will reduce the incidence of the pre-eclampsia. We will increase the detection of pre-eclampsia, and also we will increase the awareness during the danger signs during pregnancy. What are that awareness? That is, the awareness is the headache, blurring vision, and swelling of the feet, abdominal pain. And also, if we detect these cases during the antenatal care, we can decrease the eclampsia cases. Ultimately, we will reduce the maternal and perinatal mortality. Preventing the eclampsia, if we treating the approximately 7 women with severe pre-eclampsia, we can prevent the 1 case of eclampsia. What are the challenges? Still we have some challenges, because we know that in our country is still that the management of the eclampsia and preeclampsia is still in the facility level. So our challenge is the antenatal care, as it's a care during the pregnancy in third trimester. Is the latter part of the pregnancy is the very low, and the service provider's knowledge and skills regarding the detection and screening of during care is need to be improved, and availability of the ANC logistics, that is blood pressure machine, urine test facilities, this is very much challenging for us, and calcium supplementation during the antenatal care mothers, and availability of the magnesium salt, which is the very much important drug for prevention of this eclampsia to the service providers. So in conclusion, we can say eclampsia is the major contributor to maternal and neonatal mortality that we can reduce for early detection of pre-eclampsia, which can be done during pregnancy and to reach those who are not using the antenatal care. And eclampsia also can be prevented through early detection and prompt treatment by the injection magnesium salt, which is the treatment of the severe pre-eclampsia. So magnesium salt is the effective and needs to be scaled up throughout the country. Thank you.